Welcome back to Real Mummy. I hope you all had a Merry Christmas and a Happy New Year and spent the time with family and friends and enjoyed the overindulgence of the festive time. Speaking of overindulgence, this week's episode is all about mastitis, when those breasts just can't handle all that amazing breast milk you have made. We'll cover everything from the signs and symptoms you should never ignore to the do's and don'ts of managing this pesky issue. On another note, 78% of you that listen to this podcast frequently don't follow or subscribe. Please could you do me a favour and hit follow or subscribe? The more followers and subscribers I get, the more exciting and bigger guests I can have on. If breastfeeding isn't a topic you are interested in, a lot of our listeners have gone back to previous episodes for some other mum wisdom or experiences. The episodes aren't in any specific order and I've structured them in a way that they can be listened to at any time depending on what you are feeling that day. So, if you want to learn more about the wonderful world of breastfeeding, grab a cup of tea, find a comfy spot and get ready to empower yourself with knowledge that'll make your breastfeeding journey smoother and more enjoyable. Let's dive in. Hi Leah, welcome back to Real Mummy.
Hello, thanks for having me back.
So I'm so excited. So for anyone who hasn't listened to our other episode, Leah is a dear friend of mine, who a mum friend, a school friend, all of the above. She's a physio and who's also specialises and takes interest in lactation. So she's coming on to talk all things breast related.
Thanks for having me. I can't wait. This is probably one of my favourite topics because I think it's such a big concern that mums have when they are breastfeeding. So, yeah, I'm excited to talk about this one.
Honestly, mastitis, it's like this thing. It's like when you're breastfeeding and pregnant, it's like this dreaded, like it's like a swear word. It's like, you know, no one wants, it's like the dreaded M word. It's like anyone that's like, oh, you might have mastitis. It's like, oh my gosh, it's like the worst thing that can happen to you, you know?
Absolutely. And I mean, I think with good reason too. It can be really debilitating, right? And, you know, I can see why there is this fear and this worry around it, to be honest, because you get quite sick with it. And yeah, I think for me, I never personally had it, thank goodness, but I did come close. And I think knowing what I know about it, how to try and prevent it and then manage it quickly. And that's the real key, which we'll talk about a bit later.
Yeah, I was very lucky as well. I never got super sick and I never even needed antibiotics. I got onto it so quick. And I was lucky enough to have two best friends who were a midwife and one who is a physio with lactation. So I was very lucky, but I know like that's not most women. And some women have no idea about it and any of the signs, symptoms, how to treat it. So yeah, super excited for us to delve in and yeah, learn about this horrible M word. So Leah, what is mastitis? Give us the best, you know, most broadest topic. What is mastitis?
Well, it's quite simply, it's just inflammation of the breast. That's all that mastitis means. You know, its incidence, so how frequently it occurs, it's only somewhere between 1 to 33% of lactating women. And most of those cases we tend to see in the first 2 to 3 weeks postpartum. So, you know, it's more likely to occur in the early days after having a baby. And there's lots of different types of mastitis and symptoms. The main two types really that we're dealing with lactation is the infective or the non-infective type of mastitis. So just really, really briefly, if we're talking about infective mastitis, it's where there is inflammation and that is related to an infection. And most often that's a bacterial infection of some kind. Non-infective mastitis, that's just purely inflammation. That's not related to an infection. It can change too. So you could have like non-infective mastitis, which could then develop into an infection if it's left untreated. And then if you had an infection, that can also then lead to an abscess. Now, an abscess is really uncommon, but I have seen it several times in the clinic. Less than 3% of women who have mastitis may then develop an abscess. So,
Okay.
it's quite low, but there is still a risk, and it's more if it's not treated quickly and promptly.
Yeah.
Um, yeah, and then something else to think about with mastitis, and this is quite a common misconception, I think, is that when women have mastitis, often they can get a fever.
Mm-hmm.
And that doesn't necessarily mean that there's an infection. So we used to think that was the case, So if a mum was presenting with a fever or flu-like symptoms, we think, oh, it must be an infective cause of mastitis. They need antibiotics straight away. And it's actually not entirely true, which can make it tricky. So, if we don't actually know what kind of mastitis it is, how do we manage it?
That's so true. Yeah.
So, yeah, it can be quite tricky. We'll talk a bit about how to manage it a bit later as well.
Yeah. So what are some of the signs and the symptoms? So I suppose for me, this was the most important question, because it's like, if you can kind of look at home and you think, okay, I've possibly got it, and then you can get onto it early. So for me, this was the most important question. Like, what are some of the signs and symptoms that mums can figure out on their own and see at home?
Yeah. Well, with mastitis, most often the symptoms will appear quite suddenly.
Mm-hmm.
And that's why it's really important that we treat it promptly. So I've seen women who have literally just woken up after having a nap. They've been completely fine before they've gone to have a sleep, and then they've woken up and they've got chills and the developing signs. So what are some of those developing signs that we'd want to look out for? It could be any of these following symptoms. It could just be one, or it could be all of them. But generally, we're looking for heat, redness on the breast, pain, fever, flu-like symptoms, chills, body aches, or just generally feeling really unwell. Like if you ever think about when you've had a really good flu, and you just feel like absolute rubbish, that could be a sign that you are experiencing mastitis. The women that I see in the clinic, they generally really, really run down. They're exhausted. They're at the end of their tether. And so, managing and treating that is really, really important to do that quickly, because it can be quite debilitating and, really affect a mum and her breastfeeding relationship with her baby.
It'd be quite hard as well, like when we were saying about the signs and symptoms, because it's the most tiring, especially those first few weeks. You've just given birth, and you've got this baby and you're already exhausted and sleep deprived, so that's kind of like, so maybe some mums as well, like they think they're, exhausted from that, and it's not necessarily mastitis. And same as like, I know when my milk came in, I had the most uncomfortable breasts, and they were just, they were feeling warm, and it's just like uncomfortable. And then with being sleep deprived, you were kind of like, oh, okay, like, is this it? Isn't this it? But yeah, like I remember when I knew, I had like that red like lump, like a red like spot on my breast. It just kept getting bigger. So, but yeah, like it's no joke, what it all goes through. So, how does it happen? Mastitis, how does it happen? Like this is, all as women, and they're all eagerly listening. How does it happen?
Yeah, so there's lots of different potential causes for mastitis. Most commonly, it is where the volume of milk exceeds the volume removed. So if there's not an adequate amount of removal of breast milk, or there's big long spaces between feeds or something like that, what then happens is we get a stasis of milk or a backflow of milk. So it's basically a stopping of that, movement of milk, and that can then lead to blocked ducts or engorgement. What then happens is you get this sort of backflow and this pressure build up within the milk ducts, and the milk then can start to sort of leach into the ducts, or out of the ducts, sorry, into the surrounding breast tissue. So then what the body does, it goes, hey, this isn't meant to be here. You're meant to be in the milk ducts.
Yeah.
So it then triggers this inflammatory response because the body's recognizing this milk is not where it should be. And that inflammatory response comes in really hard and really fast. So that's why women often get so unwell with mastitis.
Mm-hmm.
It's this big, big, big sudden inflammatory response. Other common causes can be localized breast trauma, or, if a woman's had a direct blow to the breast. Um, other things that could sometimes cause that could be like wire bras digging into the breast,
Oh.
or even like laying on that side at
Mm-hmm.
night and not moving. Sometimes that can cause inflammation in one area of the breast. And nipple damage. So cracked, grazed, bleeding nipples that can then open up the pathway for bacteria to enter into the breast. So common risk factors for developing mastitis are usually women who have like a lowered immune status, and that can even just be due to exhaustion and fatigue, sleep deprivation,
Most mums.
most new mums are dealing
Yep.
with. And then stress. Other things that may contribute could be poor nutrition or hygiene, or if they're already ill, something else, and then their immune system is lowered. And then another really big, big factor for developing mastitis is if you have had a previous history of it. So that could be, if you had a case of mastitis a few weeks prior, or it could be had it with previous children.
So that leads on to my next question. I was just going to ask, is it possible to get it more than once? So, because I only got it the once, and I think in my mind I was like, oh, that's it now. Like my breasts know what they're doing, but it is possible to get it more than once. Oh my God. And between children, so it's like, so you're more likely to get it if you've had it with your first, then you have another child. Is that right?
Mm-hmm. It does increase the risk. And yeah, like we just talked about, having a previous history is a considerable risk factor. I've treated some very, very unfortunate women who are on their third or their fourth episode of mastitis. And like I said, it could be because, they've had lots of different risk factors, or they're just kind of predisposed to it in some way. But yeah, unfortunately, I have seen many women who have had that happen. And you could imagine how difficult it would be to be on your third or fourth episode and thinking, what am I doing wrong? Can I keep going? Like, is it worth breastfeeding if I'm going to get sick so much? And to work with these women can be really challenging, as you could imagine, because they just want to give up. They're like, it's too hard. And amazingly, most of them tend to keep going. And that is also actually really important, with mastitis. Having mastitis is not the time to wean.
Yes.
You've got to keep removing that milk. So I think that in a way it kind of encourages them to keep going as well. Yeah.
Yeah, I can't imagine having it that many times. Like it would be debilitating. And like I said, you're already trying to look after this little baby, and then your body's going through like fighting off constant infection. And it's cruel, really, isn't it? Like you feel like you're doing the right thing by breastfeeding your child. And then it's like, come on, like I'm doing the right thing here. It's like, I'm trying. And then, oh God, how heartbreaking.
Yeah, absolutely.
So, would it clear on its own? So like if a woman's got mastitis and she's gone and got her diagnosis, and then she comes home, and then like does she need to have special treatment? Or do they need to go see their GP about it, or will it just go away on its own?
Yeah. So in some cases it can, in some cases it can't. Some mastitis can be managed quite well at home. The recommendation is that if you don't start to feel better, or you get worse within 12 to 24 hours, or if you suddenly start feeling very unwell, you must go and see your doctor. And that is because we know how quickly it can develop. And if it is left untreated, it may develop into a breast abscess, which, has all sorts of other complications associated with that. So, You really need to monitor your symptoms super closely
Mm-hmm.
if you are experiencing symptoms. And, you know, as soon as you notice anything worsening, seek medical advice.
Yeah. Because like this is backtracking a bit. So like for like a breast abscess, like like is that usually surgery for breast abscess, or like is that quite yeah, a not nice not nice treatment?
Yeah. So usually what happens with the women that I've seen in the clinic is they are having treatment for mastitis, but things just aren't getting better.
Mm-hmm,
So they
mm-hmm,
would have had antibiotics, they've tried several things, and then it might clear up for a little while, and then all of a sudden it comes back again. And
mm-hmm,
it may suddenly get really worse. And then what happens is we tend to refer them for a breast ultrasound, or send them straight to the hospital. And then, yeah, what happens is they aspirate the abscess
mm-hmm.
to try and get rid of all the fluid that has, accumulated in the breast. And you can imagine, having to do that on top of trying to feed a baby and look after a baby. And yeah, it's really, really difficult to manage that. So,
That sounds
yeah,
horrible.
generally it is, yeah, like a minor procedure to deal with the abscess. Yeah.
So that's if mastitis say doesn't get treated. Is that right? So what kind of
Yep.
things can what happens to treat the mastitis, and what will they kind of, I suppose, tell you to do?
Hmm. So, firstly, you need to feed the baby. Like I said earlier, when you have mastitis, it's not the time to wean or
Mm-hmm.
stop breastfeeding, because you're going to get more of that stasis of milk flow, and it's
Yeah.
going to make the issue worse. So you really need to try and keep the milk flowing and keep feeding. And then, of course, treat the inflammation. So think about if you've ever sprained your ankle or you've sprained a joint. What would you do? You'd probably go and put a cold pack on it
Yeah.
to try and reduce the swelling and reduce the pain. So you do the same with the breast. It's no longer recommended to use heat to manage mastitis.
Okay.
The only time we would suggest using heat is just directly before a feed to try and promote the milk to flow.
Mm-hmm.
So um, it's not suggested to use heat in between feeds or directly after a feed,
Mm-hmm.
but only just before you want to feed to try and
Mm-hmm.
get the milk flowing.
Yeah.
In between feeds, you want to be using a cold pack. So that's the best way to try and settle the inflammation. And then, of course, you can take non-steroidal anti-inflammatories when you're breastfeeding, and more specifically, ibuprofen. Is completely safe
Okay, I didn't
when
know
you're
that.
breastfeeding.
I didn't know it was actually
And then if you
safe.
just
Yeah.
need some more pain relief, Panadol is completely fine.
Okay. Yeah.
Um, One of the major things that um, really, really helps to manage mastitis, but often isn't always a possibility, is rest. So, you know, if you are experiencing mastitis, now is the time to call on your support systems.
Yeah.
You know, don't be afraid to get someone to help you. You know, if you have older children, look after the older children. You know, we often recommend, if mothers can, lay in bed with your baby and just feed them uh, as much as you can and get the rest that you can.
Yeah.
Um, and then, like we said earlier, if things get worse within 12 to 24 hours or you're not improving, go and see your GP for a prescription of antibiotics.
Yeah.
It's also completely fine to continue breastfeeding while you're on antibiotics.
Okay, that's really good. Yeah, to know. So, yeah, rest, rest, rest. And like you said, that's like the hardest time is, you know, the hardest time for mums, but like you said, like if you can get support and reach out.
Absolutely. There's also, on a side note, there is a role that I play in treating mastitis as a physiotherapist. So not only, advice and education, but therapeutic ultrasound is something that we use in the clinic.
Okay.
And therapeutic ultrasound, again, its aim is to just essentially reduce the inflammation at the breast and to try and promote milk to flow. So it's a non-invasive form of treatment, which often women will come and try out. Particularly if their mastitis isn't improving,
Mm-hmm.
they tend to seek physiotherapy. Yeah.
Is it kind of act like a bit of a massage? Do you feel like doing the ultrasound or?
a very gentle, non-inflammatory type of massage. Yes.
So that's what I was going to
We
say.
don't recommend massage.
Yes. Okay. Yeah.
Heavy massage with mastitis, because of course, if you just sprained your ankle, would you really want to get a heavy massage on it? No, because it would increase the inflammation. So, so yeah, I use that word massage.
Yeah. Yeah. I think that's why it's nice to know for mums who think, hoping they're not going to be poked and prodded and things like that. Like it's when you're already so sore and sensitive, that it sounds like a nice, like I said, non-invasive and gentle treatment.
Absolutely. And another recent change in recommendations with managing just like a blocked duct, not necessarily mastitis, but if you have a blocked duct that's causing you a bit of discomfort, we used to say, get in the shower and massage it out as much as you can, to try and push out the block. And that is actually a major contributor to increasing inflammation. So we tend to say, no heavy massage, very light, gentle strokes, as if you're sort of stroking your pet cat, very light and gentle, just to try and encourage the milk to flow and the lymphatic flow, but not enough to increase the inflammation.
That's mad. That's literally, I got told that information. I had a blocked milk duct when I finished breastfeeding. So, like Maeve, my youngest, she'd had enough. She didn't want the boob anymore, and I still kind of had milk there. So I was trying to wean her off slowly, and that's when I kind of got a blocked duct. And then someone advised me to go in the shower and just keep massaging pretty much until it came free. So my poor breast, I came to that show, was red raw from trying to because I was so scared of getting mastitis again, and I was trying so hard. And yeah, when you said that, I was like, that's literally what I got told to do. I didn't get mastitis, luckily, but yeah, but it wasn't a nice experience anyway. They were so sore.
Yeah. And I don't think you're alone in that, Lucy. Like, I think a lot of mums try and do a similar thing. There's that belief you've got to try and just push the block out. And that often just leads to increasing inflammation because you're being quite vigorous with your breast. So it is, it's common to try and do that. I certainly did, where I knew all of the things about breastfeeding. In the early days of my first baby, I remember doing the exact same thing, and it never worked for me.
No, I don't think it's just a panic. It's like, oh my God, I'm going to get mastitis. It's just this panic. Like I said, there's this big, it's just everyone's so paranoid about getting mastitis, and it's just, it makes you do probably silly things that you wouldn't normally do when you're not and you're already sleep deprived and you've got a baby crying, and so okay, so I've learned lots of new things, but that especially is very new. So 2 years, like crazy. So you mentioned before the best thing for obviously the treating kind of mastitis is to feed your baby, but I've heard a lot of women are quite scared to feed their baby because obviously it's kind of like this bacterial infection, and is it contagious to the baby, or will it affect your milk or the baby at all?
It is a good and really common question. So no, mastitis is not contagious. Your baby will not get sick from drinking your milk if you have mastitis. So it's completely fine to feed, and in fact, it's recommended to keep doing it, like we've talked about.
Yeah.
The only changes that may affect the breast is that mastitis can make milk taste a little bit saltier.
Okay.
So sometimes babies might fuss a bit.
All right.
Or they can sometimes even refuse the breast. So if you have mastitis and your baby's like, no, I do not want to drink from that breast, it's recommended that you express that milk anyway, to still keep removing it. Some mums might also experience a slight dip in milk supply in the infected breast during the time of having mastitis. And I think, from my knowledge, it is basically nature's way of saying, hey, okay, we've had too much milk build up in the breast. Let's just slow down production a little bit to let things recover. And then when everything's settled down and there's no inflammation, then the milk supply tends to back up when it's resolved. So don't panic if you have mastitis and you're listening in now. If you're worried about your milk supply dropping, it will pick straight back up soon as things start to settle and improve.
Okay, so that's so good to know. So breastfeeding, is there anything you would say to them to help them prevent from getting mastitis?
Yeah. So things to keep in mind to try and prevent mastitis would be making sure that your baby's positioned and attached really well to the breast. So that way they're getting the most milk removal as possible and they can get the milk out easily. Allow your baby to feed for as long as they want to. So don't try and cut your baby off during feeds. If your nipples feel sore, certainly you can take the baby off the breast as soon as they stop sucking or swallowing, so they can fall asleep. Treat your damaged nipples really promptly. Don't keep persisting through the pain. There's lots of things that can be done to help manage, damaged or sore nipples. So that's really, really important. It can help to try and start each feed on alternate breasts. So, make sure that you are moving milk evenly and equally through both breasts. And, if baby has a preference to one side, try and start them on the other side so they're still removing milk on the opposite breast. Things like that can be really helpful. Like I said earlier, if your baby isn't feeding from the breast, make sure you're expressing the milk in some other way, whether it's through pumping or hand expressing. And try and look after your well-being. Like we said, mastitis is more likely to occur if you're really run down. So take care of yourself, rest, drink lots of water, eat lots of good food to help support your immune system. They'd be the main things to try and help prevent mastitis. And of course, trying to avoid sort of massive blocks where you're not feeding.
Okay.
So just keep trying to make sure that you're getting regular milk removal. The breasts start to get a little bit confused, especially in the early days when breastfeeding's being established. You want to make sure that, you're not going, from feeding every 1 to 2 to 3 hours to then all of a sudden a 6-hour break, if you want to go out for dinner with friends or something like that. Your boobs are going to go, whoa, what's happening? Milk's not getting moved all of a sudden. And then you get that backflow because all that milk is there ready to go, but it's not being removed. So that's a big one.
So this is I'm asking you here as a mum. So when I was feeding, when I was tired, like I would always forget what side I started on last time. So is there any trick that you would say as a mum here that you did to remember what side you started on last time?
So I'm the notorious breast jiggler. So every time I need to feed, I do a quick, size, feel and measure, and then I tend to feed on the breast that feels more full or more uncomfortable. That works for some, but not all. So some women might record which side they fed on last, like through an app on their phone, or they might just have it written down next to them on their bedside table at night. I never had to because the breast jiggle kind of told me which side I needed to feed from. Anyway, or there's also I don't know if you've seen some mums, they have like a hair lackey.
I was just going to say that.
Switch it over. I remember a good friend of mine telling me that's what she did when feeding her baby. She would just kind of, take the hair lacquer off, put it on the other side, and then she could remember which side she last fed from. So, there's lots of different ways.
Yeah. And that's what I mean. I remember her telling me that because her breasts never filled. Like, I remember mine were like yours. I would just have to feel them. And it's so funny, especially when you're out in public and you're like, having a good feel. Like, okay, which one's the fullest? And I can see people looking and I'm like, oh God, which one is it again? You're having a good feel. And it's like, yep, it's that one. But a friend whose boobs didn't fill up, like she couldn't do that. So she had to, and then she did the hair lacquer trick. And I was like, that's so clever. So I've asked a few mums that as well. I'm like, share these little tips because they're good to know.
Yeah, for me it's such an automatic autopilot thing that I do, and I often catch myself in public doing the breast feel and jiggle, and I think, oh, hang on, now's not really quite the most appropriate time to be feeling myself up. So I do have to stop myself at times, but yeah.
So my last question for you is I suppose I'm asking as a mum, as well as like a physio. But do you find there's a lot of conflicting information about mastitis? Like I mentioned before about, I got told to go in the shower and heavily massage to get my milk duct out. And then I mentioned before that, when I did have like a little red spot, and I asked the child health nurse at day 5 postpartum, and she was like, no, it's not mastitis and it's not a blocked duct. And it turned out it was, but like, have you found the same? It's kind of like you don't know what information is right and what's wrong.
100%. And this is something that is a major barrier for breastfeeding women. There is just so much conflicting information and advice. And this comes from not only just like well-meaning family or friends. So, if you are talking to someone about it on a personal level, they'll probably tell you about their own experience or what worked for them or what worked for their, friends, cousins, auntie. And, a lot of that is obviously, some of it might be correct, some of it might be completely off the center of where they need to be doing. So, certainly from then. But the bigger problem that I see is lack of education in the people that we trust, our health professionals. The people that we assume have a lot of breastfeeding knowledge. It's not necessarily the case. A lot of primary healthcare providers have had very minimal training in breastfeeding or lactation. So there's that. Plus, things are changing all the time. More evidence comes out that shows, this is what we should be doing now as opposed to what we should have been doing 2 years ago. Just like the recent recommendation to use ice instead of heat. So, we rely on healthcare professionals to keep up to date with this information. So if that's not being done as well, then, we might be getting advice that was relevant 10 years ago. Unfortunately, I've heard stories, and I'm not singling out particular healthcare professionals because I think this happens across the board, but, I had a mother who was told some advice about mastitis and breastfeeding from a pediatrician, and it was all, well, when my wife had it, this is what she did. It wasn't necessarily like, these are the current recommendations, this is how we manage it. It was like, it was based on a personal experience from someone who we would really highly trust with that information. So, it's something that needs to be improved. The evidence is there and it's clear. It's just finding the right sources and then, trying to seek information that is up to date and correct. So some, leading on from that, some things that, if you're sitting at home listening going, well, who do I turn to then? If my healthcare professional, like,
who can I trust?
That up to date with lactation. You could try and seek a healthcare provider who has breastfeeding knowledge or an interest in it, or alternatively go to your government websites or go to the Australian Breastfeeding Association. They would be the most up to date in regards to mastitis, information and care. Just, I guess, tread with caution with who you're seeking your advice from, and try and seek out those sort of sources for the best information.
What about, is there like I suppose for the mums who maybe are in a rural area or they can't get to see a professional, like it's just too hard or they can't get in, and you know what it's like lately to even see a doctor. So is there I think there used to be like a hotline you could call, like a breastfeeding hotline. Do the ABA still have those?
Yeah, so that's what I would suggest, is calling the Australian Breastfeeding Association helpline. So that's actually a 24-hour helpline where you'll be immediately put through to a trained breastfeeding counsellor who can then give you advice and listen to what's going on and sort of help guide you as to where to go from there. So that would be your go-to, in my opinion. Alternatively, if you need a prescription for antibiotics, you'd be best to try and, seek a telehealth appointment, especially if you're quite unwell and you can't even leave the house. Quite often if you just ring up a clinic and tell them that you have mastitis or you think you have mastitis, you'll be seen to and, fit it in somewhere in their diary. So
Okay.
you'll be kind of triaged as, a high priority, and you'll be seen to, or someone will give you a call. So I know in our clinic, if a woman rings up with mastitis, we make space, and we try and make space for that mother within, 12 to 24 hours of them calling. So, clinics may say they're booked out for weeks. If you go online and look at, their appointments, don't be put off. Ring up and talk to the receptionist and tell them what's going on, because 9 times out of 10, someone will see you quite promptly.
Okay, that's really good to know, because I would have, like I said, nowadays it's so hard to get in to see anyone, and you look online and it's like, I'm the same with the kids, and I'm like, GPs are booked out for 6 weeks, and I'm like, well, what happens if it's an emergency? And for mastitis, when we're so encouraging women to get onto it so quick, so that's good. Drop the M word, drop the edit M word on the phone call, and
Yeah. Or, worst case scenario, go to the hospital.
Okay.
If you have nowhere else or no one's, getting back to you, just go straight to the hospital.
Yeah, and just get it treated as soon as you can.
Yeah.
Well, thank you so much for coming on, Leah. I've breastfed 2 girls, and I did end up with mastitis, but I have learned so much today. And I wish I'd listened to this when I was breastfeeding to start with. So
No, it's my pleasure. And I think, if we can get the word out there more about these things, it can, help ease people's worries a little bit, because, right, well, this is what I look for, this is how I manage it, rather than there being, all this conflicting information and confusion around it. And about what to do. So hopefully this helps if you're listening.
Definitely. I feel like it's not as scary as you kind of think it is. You build up in your head and you hear all these horror stories, but usually the horror stories are like the ones that they haven't, it hasn't been treated right. It's ended up in the abscess, or, it's kind of just been kind of forgotten about until the last minute. So it's kind of, it's refreshing to know that it can be kind of got onto quickly, and, women can get onto it without feeling really, really sick. And I think, it was great. Thank you so, so much for coming on and, sharing all your wisdom. So
thank you.
Thanks, Leah. Thank you so much for tuning into this episode of the Real Mummy podcast. Remember, every mum's journey is unique, and you are doing an amazing job. Please be sure to head over to our website at www.realmummypodcast.com to stay up to date with the latest episodes and dive into our recent blog articles filled with even more wisdom and stories. We absolutely love connecting with our listeners, so don't forget to follow us on social media. You can find us on Instagram, Facebook, and Twitter at Real Mummy Podcast. Join the conversation, share your thoughts, and become part of our supportive mum community. And I'd love to hear from you. Have you got a topic you want covered? Do you have a guest you'd love to hear from? Reach out to us through our website or social media. Your input is invaluable and helps us to create the content that matters most to you. Thank you for being part of the Real Mummy podcast family. Until next time, stay strong, stay kind to yourself, and remember, you're never alone on this journey. You've got this.